These 3 things could save your patient's life and your nursing career when it comes to understanding blood thinners. So first, let's clear up the biggest misconception over here. Not all blood thinners are the same. There is a big difference between anticoagulants, antiplatelets, and thrombolytics. And understanding this could mean the difference between effective treatment and a critical error. Starting off with anticoagulants. These are the least aggressive of the 3, and they work by interrupting that clotting cascade, which is that process that leads to a clot formation. They prevent new clots from forming and stop existing clots from continuing to grow. Think of conditions like atrial fibrillation or AFib. You have that blood stasis or pooling, which can then lead to that clot formation. This is where anticoagulants like heparin or warfarin come into play. And then we have antiplatelets. These work directly on platelets by reducing their tendency to clump and form a plug over an injury. These medications are used typically when there's endothelial damage. For example, patients with coronary artery disease. In that situation, platelets will stick to the damaged vessel wall and form a clot. Drugs like aspirin or clopidogrel fall into this category. And then you have your thrombolytics. These are the most aggressive. These ones are the clot busters, and they are used to dissolve existing clots in emergency situations like ischemic strokes or myocardial infarctions. Their names often end in A's, like alteplase, and they are life-saving, but they come with that high risk of bleeding. So let's go over those key takeaways. Anticoagulants, they prevent clots in conditions with stasis or the blood pooling. And then antiplatelets prevent blood clots in conditions where there is endothelial damage. And then those thrombolytics, they break down existing clots in emergencies. And remember, you guys, bleeding is a risk with all of these, so close monitoring is necessary. If you guys want a quick reference guide on how to differentiate these medications and when to use them, type thinner in the comments below, and I'll send that to you for free.